the rupture of membrane is also prolonged, that is more than 18 to 24 hours, it is usually associated with ascending route. So those are the risk factors that you can have under the pathogenesis of the ascending route. Is it clear? Now, the next thing, you have the passage of the fetus now through the birth canal. Is it clear? Now, the passage of the fetus. Now, when the fetus is going to descend through the birth canal, it's going to pass through this vaginal mucosa of the mother. And you need to know that there is normal flora and there are also infective microorganisms inside the vagina of the woman. So when the fetus descends through this infective area where there is the microflora, is it clear? When it descends through this area with microflora, it is going to be exposed to this microorganism. So if you have risk factors like prolonged labor, is it clear? Particularly prolonged second stage of labor. If you have prolonged labor, it can be associated with an increased exposure of the fetus through the exposure of the fetus of the microorganism through the birth canal. If you have prolonged labor, particularly if you have a prolonged second stage of labor, is it clear? If you have an arrest of descent, or you have a protracted descent, all of that can be associated with increased time exposure of the fetus in the vaginal canal, which can spread the microorganism to the child. So we have visualized now the pathogenesis. Is it clear? So that is why every time that you have a patient that has early onset neonatal sepsis, you must try to visualize these risk factors. And these risk factors are particularly visualized when you have the labor history. Is it clear? You have the different elements of the labor history that you have to bring out in this patient. So in the labor history, you have different points that you have to bring out, which is very important. The first point you have to bring out if the labor was induced or it was spontaneous. Is it clear? A spontaneous labor is going to be associated with increased vaginal examination, which can result to infection of a child, provided that they say child has rupture of membranes and then you are doing increased vaginal examination. You can do ascension of the microorganisms again through that. Is it clear? You have induction of labor and spontaneous. You have the duration of labor is going to be very important. Is it clear? The presentation can also be a malpresentation, can also be a risk factor for a prolonged labor. So all these are the elements which are very important in order to know if there's a infectious process. Now, you need to know that infectious process can also be visualized by the amniotic fluid. Is it clear? Still on your labor history. You are not going to see this in many textbooks, but this is more of experience than textbook. Generally, amniotic fluid color is going to be clear. Is it clear? But now we need to know that there are certain times the amniotic fluid color is yellowish. When you have amniotic color which is yellowish, it is more tending toward an infectious process. Is it clear? When you have an amniotic fluid color which is yellowish, it is much more an infectious process. So this you can still visualize in your labor history. Usually we say that the amniotic fluid can be clear, it can be bloody, it can be meconial. It can be meconial stain. Is it clear? But there are certain times which is not usually characterized. It's a yellowish discoloration of the amniotic fluid. And when you have yellowish discoloration of the amniotic fluid, it means that there are bacteria inside that particular amniotic fluid. Is it clear? So after the first 24 hours of the life of the child, you have to do CRP to this child and you have to do full blood count to find if the child has leukocytosis. And normally the leukocyte in neonates has to be between 10,000 to 20,000, and you have to also evaluate for the CRP which is greater than 6 milligram per liter. Is it clear? After 24 hours. The reason why you do this after the first 24 hours of life is that the values are usually elevated. Is it clear? When you are in the first 24 hours. For the leukocytosis, you need to know that when neutrophilia can be elevated in a case of exercise activities. Is it clear? Neutrophilia, you can have leukocytosis with a granulocytic predominance, that is neutrophilia, in cases of exercise. Is it clear? Now, the point that you need to know is that the child, when the child is passing through the mechanism of labor from the engagement down to the delivery of the fetus or the expulsion of the fetus, it passes through a great stress of exercise. Is it clear? Since that child is passing through a great stress of exercise, you can have also a white blood cell count which is falsely elevated with a neutrophilic predominance or a granulocytic predominance. That's why within the first 24 hours, we don't usually ask the full blood count because it may be faulty with a leukocytosis and a granulocytic predominance. Similarly, the CRP is not also asked because in the first 24 hours of life, the child also passes all through this stress and may have minor bleedings and minor injuries, which are going to be relieved by acute inflammatory process. Is going to be relieved by an acute inflammatory process that is going to be shown with an elevated CRP. So generally in the first 24 hours, the CRP and the full blood is not done. It is only done after the first 24 hours to 48 hours when you are thinking when these microorganisms are reduced. Is it clear? And also, when you have a child that has a premature rupture of membrane, a mother has infections already, it's always good to already treat that child of neonatal sepsis, because you need to know that neonatal sepsis is a major cause of death in neonates. Neonatal sepsis is a major cause of death in neonates. So every time that you think of neonatal sepsis, we have good risk factors of neonatal sepsis. Though you may not yet see the infection, it is always good to start with the normal protocol of antibiotic therapy for at least 7 days, as I'm going to explain in the management. Is it clear? So those are the different elements of the pathogenesis. Now, after speaking about the different elements of the pathogenesis, we now need to know the causes. We have to know also the because we have first spoken about the pathogenesis involved in the case of early onset neonatal sepsis. Now, the pathogenesis involved in the case of a late onset